Vigmed is really about needle stick injuries, or eliminating needle stick injuries, and in particular the infections caused by needle stick injuries. In Europe you have 1 million needle stick injuries every year, and if you get a needle stick injury you have the risk of being infected by one of 25 to 30 blood-borne diseases. And I guess you can imagine the trauma you will have as a nurse or a doctor when you get a needle stick injury. And the uncertainty that follows the 6 to 8 weeks before you get your result from the test. Not knowing whether you have had HIV, hepatitis B, hepatitis C. So that's why Vigmed have chosen to focus on the well-being or the health of the healthcare worker. The new legislation, or the new EU directive, is based on the trauma I just described, but also the cost of having a needle stick injury. Research show that it costs between 10 and 10,000 Swedish krona per needle stick injury, because the nurses and doctors, they have to be tested. And it is, of course, exactly that that has been the focus of the legislators. So with 1 million needle stick injuries per year and those costs, it's very obvious and it makes sense to make a legislation as the one we have seen. The EU directive came out in 2010, and by May 11 of this year, all countries should have implemented it, and most countries have. So the legislation and the EU directive is from now on active. However, not all products have the same quality, and therefore it's now important that the legislators, they start to focus on the quality of the products. Because when you pay for quality, you should also get quality. And that is the focus of Vigmed again, that we want to have safety that works. In the US, where they have had this legislation for some years now, they have seen that the positive effect of the safety devices hasn't been as high as expected. And therefore it's a good question to start focusing on the quality of the safety devices. And that is what we are going to do. We are what you could call a networking company. No human being or no organization can do or succeed on their own, and therefore we think it's important to work with partners and to work with the best. This is a fundamental part of our strategy. And therefore we want to work with nurses, we want to work with doctors in order to learn from them how to produce the best products, how to produce the best safety products. We want to work with companies making the molding forms or the molds. We want to work with the best machine makers. We are working with contract manufacturers in order not to do everything ourselves and not needing to invest in everything ourselves. It's very important to have partners. And we are working with sales distributors in Europe in order not to have to build subsidiaries everywhere, because wanting to do everything yourself slows you down. And now we can act fast, we can act with partners, because the legislation is here now. And therefore we think that our partnership model is key to success. We are more agile and we are having a higher speed, and we are going to launch one product every year, or at least that's our aim. There are a lot of interesting markets all over the world, but in order to focus again, we have chosen to focus on Europe. Europe is where we have the new legislation, and Europe is also closer. That's the markets we know. So we'll focus on Europe, and especially the Nordic markets, Central Europe, but not forgetting about the interesting opportunities in China, for instance. The competition is tough because we are up against some of the largest medical device companies worldwide, like Becton Dickinson, like Vigmed. We believe that our business model is better than theirs. We believe that we can actually manage to launch more products faster than what they do. And we also believe that our products, our existing products, are superior to the products they're having. So even though it's a tough market, we do see ourselves as one of the growing companies. Well, our two main products, the clip and the swing, the IV catheter and the injection product, they are both patented in Sweden. And since 2 weeks, we also have a European patent on our IV catheter. Apart from that, we are having some utility model protections in China on both products. So we are getting there. We are protected. We are not protected worldwide officially, and they are not approved yet, at least. We have more than 40 patents or patent subscriptions, and we have more than 8 patent families. So a lot is going on. But the published patents are European. The biggest opportunity is, of course, to launch a new product, and that is also the most important focus I have as a CEO. And from there on, I want to launch one product every year, as I mentioned. It's also a challenge to manage a company like Vigmed with so many pipeline projects. We have projects enough for many years, so to manage all those ideas and projects, not asking for more resources, that's a challenge. But I guess as a CEO, that's also a big opportunity and a positive challenge to have.